All right, I'm going to finish up chapter 20 here. There's only a couple more slides, but I didn't want to race through them. So aphasia, this isn't a disorder after a stroke. This affects the person's ability to communicate with speech and his or her understanding of language, reading, writing, and gesturing. Forms of aphasia include fluent aphasia, non-fluent aphasia, verbal apraxia or apraxia of speech, anomic aphasia, and global aphasia. I would like for you guys, you can use your Blackboard group or texting to split these different types up. And when we come together for a collaborate session, I'm going to ask you to do those. So please make sure whoever watches this first to communicate with the rest that you need to split these different types of aphasia up just to give us each an overview of what each one is, okay? Please do not forget to do that. And somebody email me, whoops, someone email me, ouch. All right, I got animals chasing each other. Somebody email me, Jesse. I'm sorry. Somebody email me and let me know when the communication has gone out, all right? We got to get this done because I am going to plan on setting up this collaborate session one day this weekend. And I have figured out that I will go ahead and do a screencast of the important parts. That will be a way of getting around for anybody who is unable to make it. I got to pause this. I'm sorry. I'll be right back. Okay, sorry you guys had to listen to me do that. My dogs were chasing my rabbit. Okay, dysarthria. This is caused by a weakness or incoordination of the speech muscles. It is characterized by weakness, slow movement, and lack of coordination of the muscles associated with speech. The speech will appear slow, jerky, slurred, and quiet with a lack of expression. And treatment includes alternative augmentative speech aids. So, you know, basically just know these the way that I'm teaching them here with you. Implications for the Jerry nurse. Communication with the older adult experiencing aphasia or dysarthria can be frustrating. Jerry nurses have to be educated on the techniques to facilitate communication skills with the older adult who has difficulties, and knowledge of the nurse needs to include equipment and resources available for effective communication. So think about that. Their mind is still intact, but they can't form the words or can't say them correctly. Again, sort of in a way, we're reverting back to more of a child who's first learning speech, but they've already got all the knowledge. So imagine how frustrating that would be for older adult whose mind is fully intact, but they can't get it out. So always remember and revert back to this person was once like me. So a question for you all. A client comes to a clinic having a previous stroke. Family members state that they hope the client does not have another stroke. Which is the best response? So A, more fruits and vegetables in his diet will decrease the risk for stroke. B, prevention is the best way to manage clients who have had strokes. C, daily wine will decrease any risk factor of having a stroke. Or D, because of collateral circulation, the incidence of another stroke is extremely low. And you guys should have picked B. Prevention is the best way to manage clients who have had strokes. And your rationale is prevention is accomplished by minimizing the risk factors. Smoking cessation, low cholesterol diet, limiting salt and alcohol intake are all changes the client at risk can do. With healthcare provider supervision, an exercise program and weight management program will help to decrease the risk of another stroke. All right, so there's the end of this one. This will be a short little part 2 to upload. So I will get 21 for you guys done hopefully here shortly.